everyone, this is Katrine and welcome back to my channel. So today I am going to do a little video on hand expression. So first, what is hand expression? Hand expression is basically like milking yourself. And I know that sounds really rough and I'm sorry, I don't mean to offend. But postpartum, breastfeeding, all of that is raw, and this is what it is. It is expressing milk from your breast. Yep. So anyway, now that we have that out of the way, when to use hand expression. Hand expression is really, really great when you just need to get a little bit of milk out, either to wet the nipple or to wet the lips of the baby to kind of entice the baby to latch on and feed for a session. Hand expression can also be used when you are getting full and engorged and can't feed because the baby's tired or you're away or for whatever reason you don't have a pump. You can use hand expression to relieve some of that fullness. And another time you can use hand expression is if you ever have a clogged duct. So hand expression when you have a clogged duct will allow you to really massage out that specific spot and to express as much milk as you can out of the breast that is affected by the clogged duct. So those are a few ways and times that you can use hand expression. So let's get started. First, I will introduce my boob. Not my boob, my boob. This is my boob. And this boob is the boob that I use to teach hand expression. So the first thing that we're going to do is actually nothing to do with the boobs, but rather with our hands. We're going to wash our hands, the happy birthday song, scrub. Remember to get under those nails, okay, in between the fingers and the wrist. Rinse, sing the happy birthday song. That should give you a good hand washing. Besides hand washing, we need to collect a container to express our milk into. So if you are going to be doing hand expression right after you've had your sweet bundle of joy, what you are going to express is not really like the liquid, milky substance that we think of. What you'll express in those initial moments is actually colostrum. And colostrum is a lot thicker and it usually comes out just a little bit, and it's usually like some beads, which is totally normal. That's part of the normal process. So if you are expressing colostrum, usually we will collect it on a little spoon. And if that needs to be, put into another container, you'll be the judge of what that container should be. And if you are past the point of colostrum, the reality is that when you milk your breast, it will squirt in multiple directions. And that is perfectly normal. It's a-okay. Don't worry about it. Don't be embarrassed about it. It happens at some point when you have mastered this skill, because it's a skill and it's a tool to be used in appropriate moments. You'll be able to aim that stream right into a small container. But if you are new at this, I do suggest that you have kind of a wide bowl. So, squirt into a wide area. That bowl should also be clean and your hands should be clean. Okay, so now that we have that, now we can start talking about the breast. So when we're going to do hand expression, there's two things that I think are important that you know. One of those things is about the hormones that you're actually stimulating to hand express. And the other is how to actually do it. So let's talk about the hormones. First of all, there are two important hormones. One of them is called prolactin. Prolactin produces the milk. Okay, so prolactin produces the milk, and then we have oxytocin. Oxytocin is the love hormone. It also is the hormone that allows for the letdown of the milk. So let me explain to you how that works if you care to know. So in your breast, you have what we call ducts. If you think about kind of like a straw, it's just like a place where the milk can flow down, okay? It's a tube the milk slides through it. Now around that tube there are some muscle cells, and those muscle cells will engage with the oxytocin and relax and allow the milk to flow. So when we have prolactin to produce the milk and we have oxytocin to allow the release of the milk, then we're able to express. Now we can talk about how to actually stimulate the production of those hormones. First thing is that we want to mimic what the baby would normally do. Okay, so generally we do suggest that the baby has an arm on each side of the breast. And what that does is that it allows for their little hands to actually massage the breast. Okay? We don't think of it as that, but that's actually what they're doing. A way to mimic that is we can massage the breast with our knuckles. Okay? Massage all around the breast. Alright, we can move forward. Okay, so we want to massage the breast. Now, another thing that baby does when they are breastfeeding is that they actually, when they put the nipple and the breast into their mouth, the nipple actually stretches and kind of goes towards the back of their mouth. And so the actual stretching of the nipple also increases prolactin and oxytocin levels. So if we can stretch the nipple, stroke the nipple, the areola, massage the breast, and yeah, it's a little weird and awkward because it's like, oh my god, am I playing with myself? But what you're doing is actually stimulating oxytocin and prolactin, so don't be ashamed, okay? It's totally normal. It's part of the process, and it's what baby would be doing, so that's what we're going to try to simulate. And by the way, another way to increase oxytocin is actually to put baby to your chest. So if you have some time to do skin to skin is amazing. Please do it if you are able to. And if not, just having the baby around in the same room should also do the trick. Now what you're going to do is actually express. So we're going to take our hand and we're going to do a C hold, which is like the C, and we're going to go around the breast. And notice that I am not going around the nipple, but I'm going around the breast tissue, okay? So, C hold around the breast tissue, okay? That's one way to do it. Another way to do it is actually to do a U hold. So I'm going to go this direction, and that's a U hold. So a C hold, a U hold, and that can go in any direction, right? So C hold, a U hold. All right, something that's very important I'm going to demonstrate is take a look at my skin and take a look at my finger. So I'm going to be doing this. Now, you see how my finger is sliding over my skin? That is not what we want to do, okay? We do not want to see a finger sliding over the skin. Now, the reason is because we create friction, and we don't want friction. Friction hurts, and friction breaks down skin. We don't want broken skin near the breast or nipple, okay? So what we want to do is we want to place the finger and move it. So you see how I am moving the skin, but I'm not creating friction. Same thing can be done with the thumb. Okay, so this is really what we want to be seeing in terms of the skin on the breast. So I'm going to go back here to this guy, and we're going to press. Okay, so I've got my C hold. Press and move forward. Okay, and really, just doing this should be enough for you to express. Okay, now once you have expressed as much as you can in this direction, then you can move and express in the other direction. Okay, and after that, just make sure that you are storing milk properly. If you continue to express, there are some people that don't use any pumps at all and just hand express. It is a bit of work, but really, after you've mastered the skill, it's not too difficult, and you'll notice that it can do the trick, like I said, in very many different situations. So, feel free to use this tool as you would like to and as needed. So if you have any questions about it, please leave a comment, or I don't know, I'll find a way to answer some questions. Anyway, thank you for watching my video, and subscribe, please subscribe. I hope you guys have a great day. Bye.